Hi, this is Dr. Akiba Green with Lake Norman Health and Wellness. I'm coming here to talk to you today about a health problem that I do see more and more often. I really want to give you some background on it. Mercury toxicity. I want to talk about the health risks associated with mercury. So, fillings in your teeth contain about 3/4 of a gram of mercury. A person with 8 fillings has the equivalent of 6 grams of mercury in his body. This is a concentration that would shut down a school chemistry lab or bring a toxic cleanup crew to a lake. Dental amalgam fillings are the silver metal-colored ones in most people's mouths. They're approximately half mercury combined with silver, tin, and other metals. The mercury leaks continually into the body's tissues, which can seriously affect your health. Nevertheless, amalgams continue to be the standard material of choice for most dentists in most developed nations. In addition, many of us are exposed to mercury from our mother's fillings as babies, from coal smoke, from industry, medications, fish that we consume, vaccinations, and other sources. So I'm often asked some key questions when talking with patients about mercury. What evidence is there that mercury is bad? Why is dental exposure to mercury the most worrying and prevalent? Why do we care about our teeth? Why do we not hear more about this in the media? When we go to the normal dentist, why don't we hear anything about this? And what can we do about it? Well, over 60,000 quality peer-reviewed clinical studies lend credence to the conclusions of a report sponsored by the World Health Organization and the United Nations, which concluded that the use of mercury in amalgam silver fillings is hazardous both to human health and the environment, and that dental mercury fillings constitute the main mercury exposure risk to humans, exceeding food, air, and water sources combined. The specific figures furnished were fish and seafood sources at 2.3 micrograms a day on average, other food at 0.3 micrograms, and fillings a whopping 3 to 17 micrograms of exposure into your body. Some experts estimate over 100 micrograms if you take into consideration the increased release from fillings during chewing, brushing, heat exposure, etc. I can tell you, there is a video that I've been showing some patients. You can get to it on YouTube. It was produced by the IAOMT, the International Association of Oral and Maxillofacial Toxicology. It's a big, huge, giant dental group. It shows what happens with mercury vapor getting released from an amalgam. That's a filling. It actually shows a 25-year-old filling, and if you look at it, you see smoke coming off the filling. And what's actually happening is there's a photofluorescent or a phosphorescent green screen behind the mercury filling, and because of that, the mercury projects a shadow onto the phosphorescent screen because of that chemical reaction. So when you see the filling that's just at the normal temperature, 98.6, you see a little bit of smoke. When they take a pencil eraser to the filling, then you see a lot of smoke. That's kind of like getting your teeth cleaned. When you take a drill or a knife to the filling, that's like getting your teeth drilled. It puts a lot of smoke out, and then they say, okay, put it in 110 degrees water, like drinking coffee, and you see a smokestack. And now here's the thing, any smoke you see at all is more than 1,000 times more than the Environmental Protection Agency allows in our air. This is a big deal, guys. It really is. It's important for you to understand that. And even the U.S. Public Health Service has also stated that amalgam fillings, not fish or industry, are the biggest source of mercury exposure and pollution that we see. Now, those studies are backing large litigation suits that are gathering pace in California, Maryland, Washington, Canada, and elsewhere, suing organizations like the American Dental Association for misinformation. It's kind of echoes of the tobacco industry fiasco, and you're increasingly seeing those connections. Many places, again, like Canada, California, Vermont, Maine, and New Hampshire, have enforced health warnings or advised against or completely banned the use of amalgam fillings in children and pregnant women. Even here in North Carolina, you're seeing less and less dentists using amalgam fillings right out the door. The majority of dentists that you see now use composite fillings or ceramic fillings, which are much safer. But you don't see any discussion about why they aren't using amalgam fillings anymore. Well, some governments have totally or partially forbidden the placement of mercury in people's mouths, and they're currently phasing it out entirely, or have stated their desire to do so. California, how about in Europe, Sweden, Norway, Finland, Denmark, Austria, which is pretty worrying for the rest of us. If they're doing it, why aren't our states or the United States also forbidding this? Well, the Swedish Parliament voted for a ban on amalgam fillings as far back as 1994. In November 2003, a new government report incorporating the views of dental associations in Sweden and dental schools in Sweden conclusively called for amalgam to be quickly phased out. Now, resistance to the dissemination of this information comes primarily from the American Dental Association and equivalent organizations in other countries. And hence, the majority of practicing dentists are not going to be open to this concept. They carry a potentially enormous liability, along with the amalgam manufacturers. We were told for years that your fillings are safe. We weren't even told anything about them. It's what they were. There was no discussion at all about this. And really, up until a few years ago, you still saw the majority of dentists using this as standard of care. But here's the thing, their defensive claims that they're safe are not based on any studies that show safety, so much as fear of being sued, mental habit, and no small measure of intellectual laziness. I see this in functional medicine. I see this in functional neurology. We see this in our clinic when patient after patient after patient comes into our door after they've been to 5, 10, or 20 other physicians, and they're looking for better answers. And the key thing is the doctors that they see aren't willing to look in the right places because it's not what they're used to doing. That's called laziness. Simple lack of ethics also plays a part, as revealed in statements like this one from an ADA, an American Dental Association lawyer. The ADA owes no legal duty of care to protect the public from allegedly dangerous products used by dentists. Dissemination of information relating to the practice of dentistry does not create a duty of care to protect the public from potential injury. The American Chiropractic Association made a comment like this. The American Medical Association made a comment like this. The American Pediatric Association made a comment like this. There would not be that association there today. To contrast this, some important amalgam manufacturers like Dentsply and Vivadent now issue clear health warnings with their products, while others have even stopped amalgam production completely, including one company, the company Degussa, was one of the world's biggest amalgam manufacturers. 50% of its turnover was derived from amalgam. They now don't make any at all. They have voluntarily discontinued the production of amalgam because of the risks of litigation against them, because they know that there are health risks. They said, we're done. We're not going to be a part of that anymore. Now, incredibly, the ADA, the American Dental Association, receives money from amalgam manufacturers in the so-called Seal of Acceptance program. You've seen toothbrushes or toothpaste or mouthwash that say they have the ADA seal of approval. That is a paid program, and the ADA gets money in return for endorsing products, including mercury fillings. This is an arrangement which would be, again, totally against the code of ethics of even the American Medical Association. Now, your personal dentist may not mean harm, and may in fact be perfectly nice and intelligent. Nevertheless, they typically perform highly unethical and dangerous amalgam filling placements or removals on the ill-informed recommendation of the American Dental Association in a dental training which quite simply does not include toxicology on its syllabus. This should come as a warning for you to look for a biological or natural dentist who is properly trained on the safe and effective removal of your amalgam fillings. Now, here's the thing. You say, I have 8 fillings in my mouth, I got to get them removed. I'm going to tell you right now, don't get them removed yet. Now, most people who have amalgam fillings, they are an issue. The bigger thing here is if you remove those fillings, even if you go to an IAOMT, natural or biological dentist, your body may be in such a shock, it's going to set you back significantly. We need to make sure that your organs can support the elimination of that mercury once it's removed. Now you're going to say, well, if I remove it, why do we have to do anything? Here's the thing. Those fillings are a reservoir. They're there, and they're allowing mercury little by little to drip into your body. Talk about that mercury vapor. Watch that video, Smoking Tooth, on YouTube. And you'll see it. It's really amazing to see what's coming off these teeth. So this mercury vapor comes off, and it gets into your body. What that means is you have mercury in your system. You remove the filling, the reservoir is gone. What's still left is the mercury that's been letting go for years. We have to remove it, but we have to make sure your body is supported first. Contact my office to help run tests to determine how much the mercury in your body is negatively affecting your chronic health issues. And we have ways to safely remove the mercury out of your body once the fillings have been removed. But we have to make sure that your system is strong enough. And don't do IV chelation. Whatever you do, don't go to some doctor who says we can chelate you and use intravenous fluids, or uses heavy-duty chelators. I've used a system for years that has worked very safely for a lot of people. We have evolved that system to a newer technique that is even safer. It allows us to work effectively to remove the mercury from your body in a safe and effective manner. And then at a certain point, we can talk about your body's strong enough, the fillings are out, the mercury is out, and it doesn't affect your health. So ask my office how you can manage your mercury toxicity safely and effectively and improve your chronic health issues today. Call 704-987-3993. Make your appointment with me, Dr. Green, today.